Hi, my name is Dr. Thurmond Lanier, foot and ankle surgeon. So yeah, we have a lot of things that happen to our feet when we age. One of the main things that happens is changes in our skin texture as well as our nails. One of the most common things people ask me about is why are their nails changing color or they become thicker? And this is very common. It can happen because of certain conditions like fungal infections, or it can happen because you may have diabetes or rheumatoid arthritis or psoriasis. So there's a lot of things that happen to our nails. They get thick and crumbly, they change color, and those are things that you really want to watch out for. One other thing that happens when we get older is a change in our joints. And so it's very common to start to have these aching pains in your feet and your ankles. I'm sure a lot of times you get it in your knees or your hips, and usually that's because of arthritis. And arthritis is basically a catch-all term for losing cartilage in your joints. And so usually the most common things people experience are stiffness, as well as pain, and especially pain a lot of times when the weather changes. And so, if you're walking outside or you're first getting up in the morning, maybe a cloudy day, a lot of people start having that kind of achiness in their foot. Biggest risk factors for folks who are getting a little bit older is falls is a big thing. And so to try to help prevent falls, you want to make sure that you have objects cleared away from the most common walking paths in your home. And so you want to make sure you have rugs that aren't moving or that are not slippery. You want to make sure that you don't have shoes or socks or things like that that are in the way that could prevent or that can make you fall. As we age, we start to get some of these deformities in our foot. So one of the most common things that you'll see are like bunions. And so, these are the big bump at the base of the toe. And if you have a big bump or bunion, then it's going to be really difficult to fit into a pair of shoes. And so one of the big things I tell folks is to make sure that you're wearing wide toe shoes that can accommodate that bunion. Also, you want to make sure you're wearing shoes that are wide and that also have good arch support. Because if you have a shoe with an arch support, that's going to make you feel the ground more, and it's going to help prevent you from falling or from not having a good base and firm support. What are the things you should do to ensure that your feet are functioning like they should? So one, you have to make sure you're checking them all the time. You have to be intentional. And so if you can't actually bend down and see your feet, one thing that I tell my patients to do is get in front of a mirror and put their feet up in front of the mirror so that they're inspecting the bottoms of their foot. You want to inspect in between your toes because that's going to be the place where infections are going to be most prominent. So you're always going to want to make sure you're intentional, you're checking your feet. Along with that, you want to make sure that you're washing your feet. Now, this sounds like everyone should know this and it sounds so obvious, but a lot of people neglect actually washing their feet. They may get into the shower, they're washing the rest of their body, and just allowing the soap and the water to run over their feet is not enough. You want to make sure you're bending down or putting your foot on a step that's in your shower, and you want to make sure you're actually washing your feet, making sure you're washing in between your toes, washing on the bottom of the foot. And when you get out, you want to make sure you're drying them off well too. So many times we see people with fungal infections because all of the moisture is retained in between their toes. And so you got to get in there, you got to bend down or sit down and put your feet on the other leg and really dry off between your toes, dry off the bottom of their foot. So that's the main thing you want to do. You want to make sure you're looking at your feet all the time, and you want to make sure you're washing them and taking care of them. When do I actually see someone? When do I see a podiatrist or a foot doctor? And so the main thing is if you're having constant or chronic pain. So you really never should be living with pain. If you have pain for more than a week or two, you should really be seeing someone about this. Again, it's going to be a quality of life issue, and it could be a problem that we could solve quickly. And it could be a problem that if you let continue to linger, it could get worse. And so pain that is not going away with normal resting or anti-inflammatories or icing is when you should see a podiatrist. Also, you should see a podiatrist just to make sure your feet are doing well. And so if you have one of those conditions like diabetes or neuropathy or some type of arthritis, you should make it a point to have a foot doctor that you see all the time. You want a good relationship with your foot doctor, someone you can call up anytime and say, hey doc, something's going on with my foot, or my foot feels a little bit different. Do you mind taking a look at it? And most foot doctors, they will not mind this, especially I don't. If you call my office and say, hey, I need to come in and see you, we're gonna see you the same day or the next day to make sure that you're doing okay. So if you're having a lot of pain that won't go away, or if you have a condition that needs to be monitored, you need to make sure you're seeing your podiatrist.